So here we are, we had to make a stab incision to open, and this came out right there, and you can see that this is a silk suture right there. And we have a few more that we are going to take out, and we'll show you as we go along, and we'll leave this open for drainage purposes. Okay, so you guys were able to see what I showed you is patient had a facelift. She's 2 years out and she had delayed granulomas and lots of pain and small suture abscesses, and that was silk suture related, and it is a pain in the neck. And I have to give credit to the patient's husband actually, because you know he kept looking. He said, "Doc, I think there's something underneath." And then one time he said, "I've pulled like a black string." I didn't even believe him, and then when I saw, I was like, aha, maybe he's onto something. So we were able to go in today and take those out, and that was such a relief. So I'm very happy. I want to show you the sutures that came out, and that gave her an immediate relief, especially the long one. She feels that there's no tension. And for all the surgeons, because even some very experienced surgeons in the country, I'm not going to say names, they know who they are. They recommend sometimes put in like a 1 or 2 silk sutures. Please stay away from it. It's not worth it. What I've done is I've changed the technique where now, instead of that, for 2 jaw line defining sutures, I use 2-Proline. That's not braided, so that's not unlikely, but very less likely to cause the problem. So use 2-Proline if you want to pull the platysma back for 1 suture in the mastoid and 1 at the jaw angle defining all the way to the preauricular area. They're easy to pull out. They are not less likely to cause infection, and the rest on the top and the bottom. For the deep plane, I use 3-Vicryl, and that seems to be working really well. Same for platysma, 3-Vicryl seems to be working really well. Let's take a look at these sutures, and I hope that other surgeons can learn from it and avoid that. In my humble opinion, don't use silk. So this is the one that came from the cheek, on the top, and this one, and then this is the stylomastoid area. No, sorry, this is the stylomastoid area on the left. This is on the cheek on the top. This is the right cheek, the long one, and this was part of that one, and this is the chin. So